What are the stages of canine distemper? If you are a dog owner, understanding canine distemper is essential. This viral disease can be serious, and knowing its stages helps in providing the right care. Let's break down the stages of this disease and what they mean for your furry friend. The first stage is the early infection phase. This is when the virus primarily targets the upper respiratory tract. During this time, dogs often show symptoms like coughing, sneezing, and lethargy. You might also notice a fever, which usually appears 3 to 6 days after the dog is infected. The fever can be high but often goes down fairly quickly. Other signs include discharge from the eyes and nose, loss of appetite, and sometimes vomiting or diarrhea. Because these symptoms can look like other respiratory illnesses, getting an early diagnosis can be tricky. As the disease progresses, we enter the second stage, where gastrointestinal involvement occurs. The virus spreads to the gastrointestinal system, leading to symptoms like diarrhea, nausea, and vomiting. Dogs may feel weak and may also have a persistent cough. Excessive salivation and loss of appetite are common. At this stage, dehydration from vomiting and diarrhea can become life-threatening. This is why supportive care is so important. Treatment often includes intravenous fluids to keep your dog hydrated, anti-nausea medications, and antibiotics to tackle any secondary infections. Immune support through vitamins and probiotics might also be suggested to help your dog recover. The third stage is where neurological effects can appear. If the virus affects the central nervous system, you may see signs like head tilt, circling behavior, or even paralysis. Some dogs may experience seizures or muscle twitching. A condition known as hyperkeratosis, which affects the nose and paw pads, can also develop. This stage indicates a more severe illness that requires intensive supportive care. Unfortunately, neurological symptoms can sometimes lead to long-term complications or even be irreversible. It is important to note that there is no specific cure for canine distemper. Treatment focuses on supportive care to manage symptoms and prevent secondary infections. Early veterinary intervention can significantly improve your dog's chances of recovery. Supportive care typically includes fluid therapy, medications to control vomiting and diarrhea, and nutritional support. Monitoring neurological signs is also essential. Vaccination is the best way to prevent canine distemper. Understanding these stages helps guide treatment decisions and keeps you informed about your pet's health. If you suspect your dog may have distemper, consult your veterinarian as soon as possible.